Stepping into his shoes immediately as the acting secretary of the Maryland Department of Health will be the department's chief operating officer, Dennis Schrader. Dennis has also been a longtime friend and a dedicated public servant who's also been a part of our administration for 6 years, most recently running point on our testing and hospital surge efforts during the COVID-19 pandemic. Our acting Deputy Secretary for Public Health Services, Dr. Jinlin Chan, will be leading our COVID-19 vaccine acquisition and distribution efforts. And Dr. David Marcosi, who has served on our coronavirus task force and has been the COVID-19 incident commander for University of Maryland Medical System, will, effective immediately, serve as our senior medical advisor on COVID-19. We're very fortunate to have him playing a more prominent role on our team as we face the challenging weeks and months ahead. I'm really proud of this incredibly capable and talented team and all the people that work under them. They will be playing a key role in guiding us through this critical and hopefully final phase of this pandemic response. So at this time, I'm going to turn it over to Dr. Marcosi to provide some further details on medical staffing surge.
Thank you, Governor. Good afternoon. It's a great honor to speak to you again today. At the start of November, it was obvious that we were entering a period of high risk, with the potential for peaks and mountains of new cases and illnesses. Unfortunately, the data confirms this and shows that more of us are being infected by this virus, more of us are transmitting it, and more of us are becoming ill because of it. Due to the rising numbers of cases and the recent holidays, I am very concerned that these next few weeks and months will be challenging as a result of continued and likely accelerated spread of this virus due to Thanksgiving. I do understand. We all just want to take one day off from COVID-19, especially during the holidays. Unfortunately, the virus doesn't take a day off. We know that millions of Marylanders did the right thing over Thanksgiving. They stayed home. They gathered with only their household contacts and avoided risky activities. To them, thank you. You have helped make a difference. Please keep it up. It's easy to just think about the impact of this virus as something abstract or inconvenient that will run its course, like a few bad weeks of winter weather. But let me be clear. There is no ceiling to this, or at least one we do not want to test. In other words, cases, hospitalizations, and deaths will continue to rise unless we take it on. Our actions, what we do as individuals, will stop the rising case counts and slow the spread. We did it before, and we can do it again. In fact, earlier today, I had the privilege of speaking with leaders and parishioners at the Calvary Baptist Church in Baltimore, who are thinking through the impact of this virus and how best to protect themselves and others during this high-risk time. They are figuring out how to fight back, and so should all of us. I have spoken before on this and want to continue to emphasize the importance of seeing your doctor or nurse practitioner if needed. You don't want to survive this pandemic only to have your other medical conditions worsen. Many providers have the ability to see you either by phone, through a telemedicine application, or in their office safely. We all need to stay physically and mentally healthy, particularly during this holiday season. Call your doctor's office and make sure you maintain your health and have the prescriptions and treatments you need. Let me briefly tell you what it's like to work with the people I work with at the University of Maryland Medical System or at every other hospital across our state. Beds are filling up with significant numbers of patients. Testing, hospital surge plans, and our healthcare heroes, the nurses, doctors, and other healthcare professionals who deliver that care in the most stressful environments. They persevere and are working extra shifts to carry the burden. That means potentially missing time at home during this holiday season. They do it for their patients. They do it to save lives. That said, those heroes are stretched thin, and we need to think innovatively on how to address potential staffing constraints. As the governor mentioned, I believe there are opportunities for students to get involved in the response, and colleges or other higher-level educational programs could and should investigate providing credits for their organizational participation in this response. For those dedicated healthcare providers, teachers, and other essential workers who are selflessly working to support patients in our communities, thank you. I'm an Army Reserve officer and reflect on one of the 7 Army Reserve values relevant to all of us in this response so that we can keep those essential workers protected. It is the concept of respect. The Army value for respect states, treat people as they should be treated. And in the soldier's creed, treat others with dignity and respect while expecting others to do the same. It is simple. Wearing a mask is a sign of respect. Let's make it our normal. This simple thing that we wear over our nose and mouth limits the spread of our common silent enemy, and it helps protect each other. To get through this, no question about it, it will require courage. Courage to work together, courage to keep going, courage to address healthcare disparities, courage to ensure that data and science drive our decisions. Marylanders, we need to get our second wind. We need to double our efforts right now to get more of us through this healthy. If we do that, we will not only maintain our health, but also maintain our economy. I was reminded today that this holiday season's theme is hope. We should have hope. We know how to fight back against this virus, and there are safe vaccines on the way, very effective vaccines. When it is available to you, go and get one. When it's my turn, I will, without hesitation or doubt. I have every confidence in the process, and I believe that its safety and efficacy will be proven and well documented. Vaccines are the very best tool we have for getting back to normal. Our unity is our strength. We were successful in fighting back against this pandemic once before, and we can do it again. Yes, we're tired, but we're also battle-tested. We know what to expect, and we're ready for it. Let's find our second wind. Let's be smart, show respect, stay healthy. And to partially quote our governor, just wear the mask. Thank you.
Doesn't quite have the same impact, but thank you, Doctor. Any questions? Tom?
Governor, obviously these are very troubling details you just discussed. Why not announce more restrictions today, and could you walk us through the process of what could be next if this trend continues?
Well, we're taking decisions as we think they're necessary. So today we're focused on what we do about the fact that our hospitals have too many people in them. We've taken an awful lot of actions on trying to restrict the virus, and we're going to continue to look at things as they become necessary. But the current focus today is on our healthcare providers and our hospitals and those people that are in the hospital, and we're trying to keep alive.
Question, Dr. Marco. Dr. You mentioned a plea of the students can help out. Do you have maybe a couple of ideas on what the students could do to help out?
Yeah, this is certainly not just a question for me, but also for the governor. So I'll at least start. I think there's a great opportunity to involve students in the response. Students who are particularly health science students, who are partially trained and understand some antiseptic techniques, how to put a shot in someone's arm, vaccinate, how to test for, how to collect samples for testing. There's great opportunity there for colleges and universities to think through collectively how to make sure students are brought into the response.
Yeah, good answer. It's just an extender for our, more highly skilled medical professionals, because if you have somebody at the lowest level that is able to, as he said, give a shot, do a swab, work at the testing facilities, or do other things that you need to keep patients comfortable, then the nurses who are more highly skilled can focus on the patients that need their help the most, and the doctors can spend more time with the patients.
Governor, I know that in 10 minutes the CDC will be voting on their allocation plan for the first batch of vaccine, but I'm curious, in Maryland's draft plan, phase 1 or phase 1A and B, how many doses of the vaccine do you believe Maryland needs to carry out the plan as is, and how many have the feds indicated you'll get? I know this week Mayor Bowser said she only expects to get 10% of what the district needs. Can you give us an idea for our state?
But the whole country is only going to get a small percentage of what we need, because there aren't enough in production yet. So I believe, and Dr. Chan can correct me if I'm wrong, we just got this information, I think, this afternoon before the announcement. So our first batch is going to total about 155,000, I think, which is 50,000 some change from Pfizer, and the remaining number from Moderna. And that's a tiny fraction of what we need. It doesn't even it covers half of our frontline healthcare workers. It doesn't get to anywhere near what we need in phase 1. That's the bad. The good news is they have great vaccines, and they're years ahead of schedule, and we're going to get some relatively fast. The bad news is it's not enough, and so we have very difficult decisions, which we'll be getting more into in probably our next press conference, about the implementation and rollout of that plan as things ramp up. The good news in our discussion yesterday with General Perna and Vice President Pence and Dr. Birx and Dr. Fauci and the whole team was it's sort of like our testing when we started at 50 tests a day, and we got up to 50,000 tests a day now in some cases. That this is going to be a little bit of a slow takeoff as they get producing, and then hopefully we're really going to start to get some volume out. That's what we're looking at.
If I may, a quick follow-up, because it is important. The 155, is that 155 of the 2 doses, or is that 155
Well,
divided by 2?
that was exactly the same question we had. So we're gonna hopefully give you more info on that in our next press conference.
Governor, you're clearly looking for additional help and medical personnel. What's the expected deficit, and how many people do you need to sort of fill that to get an adequate staffing level?
Well, that's, maybe one of the others could give you a more accurate, we don't know exactly how many we're going to need. We know we don't have enough. And, just think about it. If we're expecting to potentially get, a couple thousand more people in the hospital in short order, I don't know how many staff you need to take care of a couple thousand extra people, but for 3 shifts a day with multiple people, it's thousands of people that we need to help.
Yeah, thanks, Governor. We're expecting initially, as the cases rise by 1,000 or 2,000, that we will need upwards of 2,000 to 3,000 people. So that's where we're making such a broad call, because people are under stress already, and so we're looking for probably 2,000 to 3,000 people to step into roles over the next several weeks.
Governor, I know you've talked a lot about the metrics that you're looking at, tracking hospitalizations and other things very, very closely. But then every time we ask about what is this the moment when we bring in new restrictions, you sort of say, well, we're working on it day by day, we're looking at all these things, and we're gonna do what we need to do. When would we need more restrictions?
Well, we just announced new restrictions last week, so it's not like we've been waiting. We've taken some pretty aggressive, probably the most aggressive actions of any state in the country. And we'll take them as we see fit, as we have been for the past 9 months.
So, Hogan, going back to the COVID relief, I know you're pushing for that. I wanted to get your thoughts on the plan coming out today from some lawmakers, $908 million. Do you think
Say that again. I'm sorry, I didn't hear what you were talking about. The mask and my hearing, and you're far away.
$908 billion for the COVID relief plan coming out from some lawmakers in Washington today? Doesn't have any money for families, but I wanted to get your thoughts on that. Do you think that's enough?
Yeah, no, it's not enough. I was pushing for this since going back to March, which is the last time the thing got through. We're pushing for a lot more. Right now, my main focus, because the CARES Act money is about to expire, and that businesses and individuals are really suffering, and there's not enough money out there, and in addition to state and local governments running out of money, that we need to help. And while, yes, we need more, it's like we need more vaccines and we need more relief money, but we'll take what we can get now. So having nothing done for 9 months is really frustrating. Getting some compromise for some amount of money right now rather than waiting until next year is probably a step in the right direction. So I've been in discussions with, I reached out to Vice President Biden, talked to Vice President Pence. I've been trading phone calls with a couple of the senators today that are part of that compromise to try to, weigh in and provide some input. It's discouraging. Secretary Mnuchin said they're not going to have a deal by the year end. Some senators are coming up with a much smaller package. So it's not enough, and I don't want to say, yeah, that'd be great, but it would be better than nothing. And my push is not for a specific amount or a specific bill or what the Democrats in the House want or what the Republicans in the Senate want. I just want people to get together and figure out some kind of a compromise.
Governor, has your office been in touch with Baltimore County in regards to the ransomware attack? And how concerned are you that this could happen to other school systems around the state?
Well, it's obviously a big concern. Yes, our administration has been assisting Baltimore County in an advisory capacity. The folks from DOIT, Department of Information Technology at the state. It's a serious issue. Obviously, they're taking point on their school system is the one dealing with the problem, but the state is trying to provide whatever input and advice we can, and it's obviously a concern to other counties as well. I know this was something that they were working on trying to fix and didn't quite get it done in time, and hopefully some of our other counties are not in the same position, but it's certainly a threat.
Governor, the Pomona Board has proposed a number of cuts to its budget that would affect ridership, and I wondered what your reaction is to that and how it might affect the economy, the music economy.
Well, so Metro, like so many other things, is their revenues are down drastically because of lack of ridership. If you'll remember, I put together a interstate compact agreement with Virginia and D.C. on saving the Metro system 2 years ago and coming up with a funding source to keep it afloat. But my push that wasn't successful was to get the federal government to pay their fair share, because most people that ride Metro are federal employees, the majority of them, and they don't contribute. And I was trying to get them to kick in. So one thing I'm going to do now with the incoming administration, the first chance I get, the day they name a transportation secretary, my first call is going to be saying, we need your help on Metro, which I tried to do with the current administration unsuccessfully, and then Maryland, D.C., and Virginia had to foot the whole massive shortfall. So it's a mess, and we're going to need some help from the federal government.
Governor, speaking of transportation, the $250 million settlement on the Purple Line, where's that money coming from?
It's going to come out of the, I think, revenues for throughout the course of the project. It's just a different split.
Governor, back to the COVID and the hospitalizations. You alluded to it. It's only going to take 2 days to pass 1,700 if the current rates continue in the hospitalization. The model has 4,000 total hospitalizations. I called around to a number of hospital organizations today. They say so far they're handling it. What is your fear a month from now? How bad will it get? I mean, you're trying to make an impression on the community about masks and the whole thing.
Well, yesterday, we had a very kind of interesting and frank discussion with most of the top hospital CEOs, along with all of our kind of public health experts and the people doing the modeling. And it's a scary situation for everybody involved. I mean, our modeling has been pretty much on track. We do see in the next few days us hitting a critical point. We think it's going to continue to get worse over the next at least several weeks. And as Dr. Marcos, he said, I mean, I believe most of the educated projections say that we are not near the peak yet, and that the worst part of this entire crisis is still ahead of us over the next month or two.
Governor, the CDC obviously had advised people not to travel over the Thanksgiving holiday, and many of our news organizations had reporters at the various transportation hubs, and people traveled in mass. What is your message to Marylanders who traveled over the holidays, went out of state, maybe defied some of this advice, and have now returned to the state of Maryland?
Well, so I mentioned earlier, a couple different groups have done studies on Maryland. 90% of Marylanders did not travel for the holidays, which is a record amount. So a lot of people were following the advice. Other people traveled, and we've said anyone who did travel should be tested, and they should take it seriously. I mean, I heard some of the folks in Washington, I think Dr. Birx was saying, if you traveled for the Thanksgiving holiday, you should assume that you're infected. I don't know if we should take it that far, but you should definitely get tested before you're around any vulnerable people.
Last question.
All right, that was the last question. Tom closed us out.
Thank you.
Thank you.